but we still have an issue where, patients, families need an outlet that is a VCP educated so that you can get genetic counseling. And so the needs, we need a reliable resource. We need to help you with efficient scheduling. We know that some people will wait 6 months to a year to get in to see a genetic counselor. We want somebody that's familiar with VCP so that you're not having to educate the party, that it's a productive conversation. It reduces the burden on you, gets you faster diagnosis. It helps your family, and these are a lot of the challenges that are out there. And so what we've done is we created partnerships and programs to try to help address this. And so today, the reason we're here for anybody and everybody is we're partnering with InformedDNA. And Ashley Cannon is momentarily going to kind of walk you through that program, their company, what they're about. But again, we're talking genetic counseling, not just genetic testing, because the counseling, cure VCP disease cannot be a counseling resource. We are not licensed to do that. We are not educated to do that. We know a lot, but you need to speak to trained resources in genetic counseling. Now, you may have seen the other news, about our program called A New Hope, Wellbeing and Rare. We're addressing that. We're targeting that towards young adult care partners. But a facet of that program is working with InformedDNA if the individual chooses to do that. So again, what we're here for tonight is just InformedDNA. It's open to anybody and everybody. And I think Ashley will speak on the stipends that we're offering, but we can talk more about that in the Q&A as well. So with that, I want to introduce you to Ashley Cannon from InformedDNA. She actually attended our VCP scientific conference back in Pasadena last year, was on a panel, and it just was kind of a small world. It worked out that we were looking for somebody. I didn't even know that she was at the conference, but I think this is going to be a great partnership. Welcome, Ashley, and I'm turning it over to you.
Excellent. Well, I'm getting my slides ready. I will tell you a little bit more about who I am, if I can do more than one thing at a time. Let's see. Okay, does everybody see my slides right now?
No, it's like very soon. Oh, here it comes. All right.
Slowly but surely it'll make its way there, hopefully. All right, let's get it in slide view. Okay, so you should be seeing the slides now. Okay, great. So hello, everybody. I am Ashley Cannon. I am trained as both a genetic counselor as well as a neuroscientist. So I specialize in neurogenetic conditions. I have experience in research as well as the clinic and clinical trials. I have worked for InformedDNA for the last 5 years, and I help to support genetic counseling and testing programs. And so I was really excited when Cure VCP Disease reached out to us and said, we know that there's a need for genetic counseling and testing in the community. And that's definitely something that we're really passionate about, because we know that access to genetic services can be really hard for some people. And that is why we as a company was started, is because we knew that most people who have access to genetic services are going to live in a major metropolitan area that has a big academic institution. And most of us don't live in those types of cities. And that's why our company was designed to be purely telehealth, so that we can talk to people regardless of where you live within the United States and its territories. So we want to make sure that you can get those genetic services regardless of where you live. So we were really happy that we are partnering with Cure VCP Disease to provide the genetic counseling and testing services, if that's what you want to do. So you may have noticed, but maybe not, that there is some more information about InformedDNA now located on the genetic testing page of the Cure VCP Disease website. So if you haven't seen it, feel free to go ahead and take a look. There's some good information on there about just genetic testing in general. But now there's information about the partnership. And so just a little bit more information that's included there is we've been around for about 15 years offering telehealth genetic counseling services. Our genetic counselors are all certified. We are licensed as well, and we see patients in all 50 states. Our genetic counselors have experience in rare genetic, particularly neurologic genetic conditions. And there aren't a whole lot of us out there that are experienced in this field. So we do think that that is definitely a value that we can provide the community. And the genetic counselors have on average 8 to 10 years of experience as genetic counselors. And it's a fairly young field. So we feel like we have a lot of really good experience and some good genetic counselors on our team. So from this website, you can also get the phone number to call us, or you can click on the referral form button that is on the bottom here. When you click on that, that will take you to InformedDNA's referral form, and you can enter your contact information, and that will get you to our care coordinator team. Okay, and I'm going to definitely talk about that process a little bit more. But before I go into detail, I want to give you the big picture of what telehealth genetic counseling is, because you may not be familiar with genetic counseling, and maybe even more so with what telehealth genetic counseling is. So this is a visual representation of the telehealth genetic counseling process. So you can, refer yourself by clicking on that referral form that you just saw, or by calling the phone number that was provided. And once that referral is placed, the patient is registered and an appointment is scheduled. And we can get you into an appointment within 10 days typically. So we also offer appointments later in the day and on the weekends, because I know that it can be hard for some people who, works, during the day to have an appointment that would be in the middle of the day. So we try to be flexible and offer appointments on off-hour times. Next is the initial appointment with a genetic counselor. And if you choose to have genetic testing, and you don't have to, the genetic counselor will order the test, and a sample collection kit will be mailed to your home. So you don't have to go anywhere. You can stay at your house, or, friend's house, wherever you feel comfortable during this appointment. You do not have to travel anywhere to see a genetic counselor. That's for the appointment as well as the sample collection. We're going to send that kit to you. And then when the test results are available, there is a post-test appointment, and that's when the genetic counselor is going to discuss the results and the implications with you. And then finally, we're going to give you a formal summary report of the information that was discussed during the appointment. And we'll also share that with any healthcare providers that you want us to share it with. Okay. All right, so you have an appointment that has been scheduled. So you might be wondering how much the genetic counseling appointment costs. Well, we try to make that a little easier for you by putting up all of the healthcare plans that we are in network with on our website. So you can go here and see if your plan is in network, or you can just talk to the care coordinators on the phone during that when you register and schedule, and they will confirm if your health plan is in network or not. And typically, if your health plan covers genetic counseling, it's usually a copay for, like, if you were going to see a specialist. So I know for me, that's typically, $30, maybe $50, depending on who that specialist is. So you will still need to pay a copay. It's usually not paid 100%. If your plan is not in network, you can still see a genetic counselor. We can give you over the phone what that out-of-pocket cost, that self-pay price is going to be for you. Okay. All right. So in preparation for that appointment, you may be wondering who genetic counselors are. We are licensed professionals who are trained in medical genetics as well as counseling. And we help patients and families understand their genetic risks. And we want to emphasize that seeing a genetic counselor does not mean that you have to have genetic testing. You can come and talk to a genetic counselor, and we can just talk and talk about your family history and your risks based on that family history and go no further. And that is perfectly fine. You don't have to do anything that you don't want to do. And sometimes it's just a conversation of what are you comfortable with? You know, how do you normally deal with stressful information? Are you a planner? We'll definitely walk you through the process of and figure out what's best for you. And you're going to be the one that makes that decision. We are not going to tell you what you should or should not do. Okay, so what should you expect during that first appointment with the genetic counselor? So we're going to ask questions about your family history. And you may not know a lot about your family history, and that's okay. And then we're going to provide a risk assessment for you and other family members based on that family history. We will discuss the genetic testing options with you, and we'll also discuss any concerns or goals for genetic testing to see if it's the right choice for you. Okay. So I wanted to share with you reasons that people pursue genetic testing, and then also reasons why people choose not to have genetic testing. There is no right or wrong decision here. It's whatever is the best choice for you. And we know a lot of information now about why people do or do not have genetic testing from the Huntington's disease community. So for those that aren't of you that may not be aware of Huntington's disease, it is also a genetic adult onset neurodegenerative disease, so quite similar to ECP disease. And the Huntington's disease gene was one of the very first that was ever identified. So people that with Huntington's disease were some of the first people that ever had genetic testing. So, they were some of the first ones that understood the implications of genetic testing. And so some of the information that I'm going to provide on this slide and the next one is coming from the Huntington's disease community, in part, but not all. So here are the reasons that people do have genetic testing. And the first reason is to reduce uncertainty. Some people just have to know. They cannot handle the unknown. They want to know one way or the other. Other people think that genetic testing is going to help them plan for their future. They want to do their financial planning. It's not as big of a deal of what they are planning for. They just need to plan for it, whatever it may be. Other people want to have genetic testing for reproductive decision making. So some people, they're thinking about having children, and they want to have testing for themselves first to see what are the chances that they would pass this to any children that they would have in the future. And so the results of their testing might inform them of whether they're going to have biological children or not. And if they do have biological children, are they going to have in vitro fertilization with preimplantation genetic diagnosis? And that's when embryos are implanted after they've been confirmed to not have the family genetic variant. And other people may decide to not have children or to adopt. So many people can have families in a variety of ways, but some people just want to know what their genetic information is before making those decisions. Other people want genetic testing to provide information for family members. And in my experience, this is usually people who are older, they have lived their life, and the genetic testing results are not going to mean a whole lot to them, but it could mean a lot for their family members, and that's why they do it. The next reason to have genetic testing is becoming more and more common, and that is for clinical trial eligibility. And that could be for clinical trials that are currently ongoing or for those that may come up in the future. So we know that there aren't clinical trials for VCP disease right now, but hopefully that will change in the near future. And as of 5-10 years ago, definitely, we did not have any types of clinical trials or treatment that we could offer for people with genetic conditions. And thankfully, that is rapidly changing. More and more every year, we are offering clinical trials, and even some gene therapies now have been FDA approved. So some people, they want to go ahead and get their genetic testing done now so that whenever that clinical trial happens, they're ready for it. And then lastly, some people want genetic testing so that they can connect with support and advocacy groups and to feel a part of the community. All right, so that is one way of thinking, but not all people are ready to have genetic testing. Some people are not. And this first reason I would say is probably most people how they feel. And that's just right now is not the right time for genetic testing for me. A lot of times that's because they have a major life event going on. So they could be in college, or they just got married, or they just had a baby, or they have some kind of stressful thing going on in their life, and they just don't want to add genetic testing as just another stressor added on top. That doesn't mean that they don't want to have testing in the future. They might want to do it in the future, but they just know right now isn't the right time. Some people don't have genetic testing because they don't have support systems in place. We do recommend people who pursue genetic testing, especially for conditions like VCP disease, where there is no treatment or preventative or cure, to have a support person with them during the genetic counseling and testing process, because it can be a lot to go through, and it's really good to have someone there to just be there with you and to help you during that time. But unfortunately, some people just don't have those support systems in place, and they just don't feel like they're able to pursue genetic testing because of that. Another reason why people don't have genetic testing is because of the psychological impact. So some people, they just don't want to know. They can't handle, knowing what's going to happen in the future. And again, that is perfectly fine. It's really good to know what you can handle and what your limitations are. And finally, there are a lot of people that have concerns about genetic discrimination. And so I really wanted to take a moment to talk more about what protections are and are not in place. And I have a feeling there's probably going to be more questions about this, so there'll be plenty of time at the end for us to talk about that in more detail. Okay, so the major protections that are in place is the Genetic Information Non-Discrimination Act, or GINA for short. And this protects Americans from discrimination based on their genetic information in both health insurance and employment. Importantly, this does not apply to long-term care insurance, life insurance, or disability insurance. Most of the time now, if you apply for this type of insurance, the application will ask you if you've had genetic testing and if you have a genetic condition. So because of that, we do recommend anyone that thinks that they may need this type of insurance in the future to go ahead and get that in place before they have any type of genetic testing, so that whenever they answer that application, they can answer it honestly. Because if you haven't had the genetic testing yet, then you can say that you don't know that if you have a genetic diagnosis or not. Another thing that's important to know is that GINA does not apply to U.S. military or employers with fewer than 15 employees. So there are some protections, but it is not comprehensive. It does not cover everybody. Okay. So you have decided that you are interested in genetic testing, but you want to know how much does it cost? That's a really great question that unfortunately does not have a simple answer. It really depends on your insurance plan. Because of that, we will do a prior authorization. So a lot of times we'll have to do a prior authorization for like an MRI or a surgery or maybe some types of medications. We can do that for genetic testing as well. So you can know in advance if your insurance plan will cover genetic testing or not. And even if they do cover the genetic testing, either partially or in total, remember, you still may have a deductible that you have to pay. So, every year, there's a new deductible that you have to pay down before the insurance plan will start covering some of your insurance medical costs. So remember that, even if the genetic testing is covered, you may still have some out-of-pocket costs that are associated with the deductible. So I find that a lot of people wait until the end of the year to have genetic testing. So because they've met their deductible already and they want to hurry up and get as much testing or medical visits in by the end of the year before they have to start all over again in the next year. Okay, so if your insurance doesn't pay for genetic testing, there are self-pay options that we can discuss. And some people, they just don't want to use their insurance plans at all, and they know from the very beginning that they just want to pay out of pocket because they don't want to risk genetic discrimination. They don't. That, whenever we bill your insurance for a genetic test, they know you're receiving genetic testing. We're not going to tell them what your result is, but they still know that you've had genetic testing completed. So some people don't want their insurance companies to know about that, and they're just going to pay out of pocket. And that is fine. We can definitely work with you on that. Oftentimes, labs will have some kind of patient assistance program, and that's usually based on whatever your household income is. And then I know Nathan had already mentioned this earlier. The Cure VCP Disease Fund is available to reimburse the genetic counseling and testing costs. So if you think that you're going to need some help to pay for the genetic counseling and testing costs, please reach out to Cure VCP Disease about that and learn more there. Okay, so genetic testing has been ordered. It depends on the type of test that is ordered. It can be a couple weeks to maybe 6 to 8 weeks. So it could be up to 2 months, and that can be a very long and stressful 2 months. But whenever as soon as we get the genetic test report, we're going to reach out to you and try to schedule this post-test appointment as soon as we can. And we can usually do that within a couple days. Sometimes, maybe based on your schedule, it'll need to be a little bit farther out, but we do try as much as possible to get you in for this post-test appointment as soon as possible. All right, so this is what you should expect in that appointment. At the very beginning, we're just going to tell you up front what that result is. We don't want to beat around the bush. We want to just go ahead and get to it first thing. And then we're going to talk about the implications of that result for you, but as well as your family members. This is a genetic condition. It can have a big impact on many people, not just you. And so we're going to talk through that. We're going to address any psychosocial concerns that you might have. We're going to provide support resources for you. And then we're also going to share that genetic test report with you, as well as that summary note of what was discussed during that appointment. We'll also share that with any healthcare provider you want us to share it with. This is your information. You deserve to have this and keep this for your records. Okay. All right. So there are 3 different types of genetic test results that you can get back on that testing report. The first is a positive genetic test result. And that means a genetic variant was found that is associated with VCP disease. And this means that there is a 50% chance that VCP disease could be passed to children. There are, as you are probably well aware, there are significant medical implications for someone with this result. And this result may mean that they will be eligible for clinical trials in the future. The second result is a negative genetic test result. And this means a variant associated with VCP disease was not found. And someone that is negative cannot pass VCP disease to their children. This isn't something that skips generations. The third result is a variant of uncertain significance, or a VUS for short. And this means a genetic variant was found, but it's unclear whether it actually causes VCP disease or not. And sometimes the lab just can't determine at the time of testing whether a genetic variant is a normal but rare genetic variant, or if it truly is associated with VCP disease, and additional information is needed. Sometimes we can do family testing to help us better understand whether this variant is associated with VCP disease or not. But that can be very stressful learning that information because you just don't know what that means for you. Medical management decisions should not be made based on this type of result. And oftentimes people with a VUS are not eligible for clinical trials, but sometimes there are some exceptions. Okay, so genetic testing in general can offer valuable insights into an individual's genetic predisposition, their health risks, and ancestry. However, it also comes with a range of psychological implications that can significantly affect individuals and their families. And understanding these implications really is crucial for providing comprehensive support and ensuring that genetic testing is used ethically and effectively. The first psychological consideration is emotional reactions. We are human. We're going to have some kind of response to a genetic test result, good or bad. Genetic testing that yields uncertain results like those VUSs can create a lot of stress and frustration because individuals struggle to interpret the implications of those results and how they influence their health decisions. For those who test positive for a genetic condition that can be passed to offspring, it's very common to have feelings of guilt and responsibility can arise. Another psychological consideration is identity and self-perception. So someone might feel that their genetic results defines their future or limits their ability to make choices about their health, and that can impact their mental well-being and how they approach their health and lifestyle decisions. Family dynamics is a big one. Genetic testing can affect family dynamics, which can lead to tension or conflict, especially if there are differing opinions on how to handle the information. And deciding how much to share about genetic testing results with family members can also be challenging. So you are all probably very aware of these types of responses to genetic testing results. You probably can teach me a lot more than I already know about this. And I'm not sharing this to overwhelm people or anything like that. I just want to share that, genetic testing has implications, and that is why our profession exists, is to help you walk through that. The responses to genetic testing results are perfectly normal. They're not bad. They just are. And we're going to try to walk you through that and provide resources, connect you with support systems that you may have, or find support systems that you may need. Okay. So this is my last slide. So if this is something that you're interested in learning more about, you think genetic counseling or maybe even testing is good for you, feel free to click on that referral link on the Cure VCP Disease website, or call the number that's listed here, as well as the website. Please make sure if you call that you mention cure VCP disease. And the reason for that is because we want those care coordinators that you talk to on the phone. We want to make sure that they connect you to the genetic counselors that have experience with VCP and know what VCP is and can provide really good information to you based on that. So please mention cure VCP disease when you call.